of Lagos. I say good afternoon to our indigenous people of Ikorodu. Another very beautiful day and a very beautiful way to welcome you to the issues here at IKD 106 with 1FM, your number one radio station. Of course, do not forget that you can hear us all over the world by our website www.ikd1061fm.ng. Welcome again to the issues on your radio station. The issues is the program where we tend to focus on societal issues around our nation, where we tend to look for probable solutions to issues that we discuss on the issues. My name is Adebambo Opayemi, and of course, I'll be your host for today, where we look at another topic that has to do with thousands of Nigerians, and in a way or the other, we neglect it. Some would say that it's a spiritual attack. Some already believe that it's not just a normal thing, it's not natural. Some will even tell you that in our family, one person would have to suffer this. What are we talking about today on the issues? We focus on blindness. Yes, you heard me loud and clear, blindness. And we look at the causes, the types of blindness, the treatment, and yes, the way forward. Talk about the prevention. I'm not alone in the studio today. It's an honor to have someone who is well good at what she does. She is an outstanding personality. She's a medical practitioner who is good with our game. Talk about Dr. or Mrs. Yemisi Alabi. She has graced the conversation today. Out of a little time where we called out for you, you reached out to us from General Hospital Ikorodu. First off, let me say good afternoon to you, ma.
Good afternoon. Thank you for having me.
It's good to have you here, ma. Dr. Yemisi happens to be the chief consultant, ophthalmologist, and head ophthalmology department here in Ikorodu General Hospital. You might want to wonder what is all that grammar for. That simply means that is one side of the medicine department that focus and majors on the eye treatment and how to stay safe with the eyes. So seeing her this morning, I know it's an honor to have you in the studio. It's really not easy bringing you up here. Thank you so very much once again. So, Dr. Yemisi, let's get straight into the conversation. When we talk about blindness, World Health Organization brought out statistics showing that over 100,000 persons yearly suffer what we call blindness. And naturally, it is becoming a norm, which is not supposed to be. Like I said earlier, some even see it as a tradition. It's a family thing. In our family, somebody should go blind. It has gotten to that point where they just say, Yorubas will say that, let me in your commercial to my shine. So first of all, I would like to ask you, doctor, when we talk about blindness, how do we define blindness as a medical practitioner?
All right. Thank you once again for having me. It's my pleasure to be here.
Yes, please.
When it comes to blindness, let me start by explaining it this way. The normal visual acuity is 6/6.
Okay.
That means if you've ever been to an eye clinic, you are told to sit in front of a chart. Maybe you have alphabets or you have letters. Starting from the very first one is a big one, and the sizes get smaller as you go down. So you are told to read that chart, and that chart assesses your visual acuity, which is what you can see. So the normal visual acuity is supposed to be 6/6.
Okay.
Now we have what we call visual impairment, which means the visual acuity starts getting worse gradually before we get to blindness.
Okay.
So from 6/12 to 6/18 is called mild visual impairment.
Okay.
6/18 to 6/60 is moderate visual impairment.
Okay.
And then 6/60 to 3/60 is severe visual impairment. So the definition of blindness is a visual acuity of 3/60 in the better eye. That is the definition of blindness.
I almost got lost at a point, but the length and breadth, the short of everything doctor just said is blindness is when you run out of a particular figure, that is the 6/6, and it drains down to some particular extent where you can no longer see as you're supposed to see, if we could put it that way.
Not really.
Okay.
Let me explain again.
Very well, please.
We have visual acuity,
okay,
which is what assesses what you can read.
Okay.
You know, so there's a chart in front of you, different figures or different alphabets varying in size.
Okay.
The first one is big, down to the very last line where we have smaller letters.
Oh, okay.
Okay. Now, every letter has a number written under it, which is what assesses your visual acuity.
Okay.
So you're supposed to be able to read one of the lines that are at the bottom, which is normal vision is 6/6. Now, when your vision is not normal, it's said to be impaired. So before you get to blindness, there is impaired vision.
Okay.
So impaired vision, we now have different categories. 6/12
6/12
to 6/18
to 6
is mild.
18. Okay.
6/18 to
Yes.
6/60 is moderate.
Okay.
6/60 to 3/60 is severe.
Okay.
Now, when that visual acuity is less than 3/60 in the better eye, that person is said to be blind.
All right, Dr. Mrs. Yemisi Alabi, no doubt, there is no doubt you're definitely the chief consultant of your department, and that is a very beautiful way to say welcome to the issues. If you're just joining us, you've not missed out a lot. I told you earlier that today we will focus on blindness, and then we look at the types of blindness, the causes, how to treat all of this, and of course, yes, how to prevent them. Every part of the body is actually very vital and important, but you would agree with me that the eyes is much more important. Without your sight, you can actually say that every part of the body would not function as much as how they are supposed to function. So when we talk about blindness, doctor, what are the types of blindness that we have? Some believe that blindness is blindness. We will take in calls, but not now. I would need you guys to really hold on for that, because I think when you hear blindness, everybody is interested. So when we talk about the types of blindness, some say that we have just one way of blindness. If you're blind, you're blind. There is no two way to it. How true is that statement, or do we perhaps have types of blindness?
For me, it's not so much types of blindness as causes of blindness.
Okay.
Because I just explained that there is what we call visual impairment and there's blindness.
Exactly.
So blindness has a definition, and that is blindness. So it's not so much types of blindness as what are the things that cause blindness.
Okay. Okay, so that cannot be compared to each other. That is for our listeners out there who perhaps think that we have types of blindness. If we say blindness, it is blindness. Let's get into the conversation real quick. We talk about the causes now, because that is more like the real conversation. What causes blindness?
Okay, so let me give a brief, should I say, statistics overview.
Okay.
So all over the world,
Yes.
globally, about 2.2 billion people have visual impairment.
Wow.
That means ranging from what is not normal to blindness.
Okay.
Now, out of these people, 43 million are actually blind all over the world. And out of this 43 million, in Nigeria, we have 1.3 million people that are blind.
Alone in Nigeria?
Yes.
Wow.
Now, the burden of visual impairment and blindness is huge. There's a personal cost and there's a cost to the society. So if an individual is blind, they are impaired from doing so many things. They cannot look after themselves. A lot of them cannot work, go out and be productive. So that is, even hygiene becomes a problem.
True.
So they need someone to stay with them. So now they cannot go out and work and be productive in the society, adding their own quota. The person that is supposed to be also working is staying at home, looking after them, taking them out, feeding. So that affects the economy as well. So the cost is both personal and then to the economy of the society. Now, when it comes to the common causes of blindness, I'll just mention a few. We've heard about cataracts, glaucoma, age-related macular degeneration, diabetic retinopathy, corneal opacity, and uncorrected refractive errors.
Okay.
So I want to take them one by one.
Exactly.
All right. Now, when we talk about cataract, what is a cataract?
Yes.
Normally in the eye, there is a structure that is supposed to be clear, like glass, so that light can pass through and then you can see very well.
Okay.
But when there is a cataract involved, instead of being clear like glass, it becomes milky or cloudy or white like paper. So it prevents the light from going through. Now, the commonest cause of cataract is age, but it is seen in all ages. You can find cataracts in children, even at birth. Children have been known to be born with cataracts. What are the symptoms, or what do patients complain about? Somebody will come and say, oh, there's a white spot in my eye.
Okay.
My vision is blurry. I can't see people that are far off. I can't recognize faces until they move near me. Sometimes people complain that when I'm driving at night, the light is scattering or there is a glare. Sensitivity to bright lights, or when you need, at night, you need a lot of light to see very well. Those are some of the symptoms of cataract. How do we treat cataract? Before it is ready for surgery, glasses can be given as an option. Now,
Okay.
glasses is not treatment in the sense that it does not remove a cataract, but it can help the person see better until they are ready to have the surgery or until the cataract is ready to be removed. Now, the definitive treatment for cataract is surgical. Surgery needs to be done. And some people have the misconception that when surgery is done, it is the eye that is removed. No, nobody's eye is removed. There is an incision made on the eye. The lens is brought out. That means that cloudy lens is brought out, and it is replaced with an artificial lens, something we call intraocular lens, after which the vision of the patient is restored.
Okay, that's beautiful. Then we move to glaucoma.
Yes.
Yes.
Now, glaucoma is another leading cause of blindness. And what is glaucoma? In glaucoma, the issue is that the eye pressure is very high. Normal pressure is between 10 and 21 millimeters of mercury. That's normal intraocular pressure.
Okay.
But in glaucoma, mostly the pressure is higher than 21
Than 21
millimeters of mercury.
Okay.
Now, there are different types of glaucoma. So in some cases of glaucoma, you still have that pressure between 10 and 21, but it is high enough for that eye such that we see changes of glaucoma.
Okay.
And what are the changes that we see in glaucoma? It is seen at the back of the eye. The optic nerve, which is what we use to see, is what is damaged in glaucoma. So the nerve cannot transmit the impulses to the brain, and the vision is affected. Two things we need to note about glaucoma. It is irreversible, produces irreversible blindness. In the case of cataract, if somebody is blind from cataract and does surgery, the person can see. But once glaucoma has produced blindness, it is irreversible. Another thing is that there is no cure for glaucoma. It can only be controlled, it can only be treated, it cannot be removed.
It cannot be cured.
It cannot be cured. It can be treated like hypertension. You don't remove it, you just have to control it. Now, what are the symptoms? Like hypertension is known as a silent killer, I want to say glaucoma is known as a silent blinder, if there is anything like that in English. Because mostly it doesn't produce any symptoms. There is no redness, there is no pain. The patient just comes, I was okay, I was seeing yesterday, I slept and I woke up and now I cannot see.
All of a sudden.
Yes. Meanwhile, that's not really the case, but because it takes years for glaucoma to produce blindness, but because it doesn't produce any pain, you know, the person doesn't really
It's
know.
really not noticed.
Yes. But in some cases, in a few cases, when the pressure is very high, you can have pain in the eye, you can have headache, you can have redness. Some people complain that when they look at bulbs, they see something like a rainbow, or loss of peripheral vision. That means when you're looking straight, you're supposed to see by your side. So some people notice that they don't see anything by their side unless they are looking straight. So if they want to see something by their side, they have to actually turn their faces to see. Some people actually complain about that. Now, what is the treatment for glaucoma? You know, I said glaucoma has to do with the eye pressure,
Yes.
intraocular pressure.
Yes.
So the main focus of treatment is that pressure, lowering it as much as possible for the particular patient. And what are the modalities? We use eye drops, we use laser, we use surgery. But like I said, all of this is to control the eye pressure. Now, because glaucoma produces irreversible blindness and cannot be cured, early detection is very important. So when it is detected early and treatment is started early, then it can prevent blindness or delay blindness such that that individual has vision for the term of their natural life.
Okay, Dr. Mrs. Yemisi, I will be forced to ask this question. You said that if detected early, you can start treatment for it, in as much as we know that it cannot be cured.
Yes.
And at the same time, you said earlier that this is something that you might not even see the symptoms. So how do we detect glaucoma early?
I was going to go to that in prevention. Can we wait until we
Okay, so
we
let's wait
address-
until prevention.
Yes.
Okay, that'll be fine then. So we can still move ahead, but if you're just joining us, it's still IKD 106.1 FM. The issues today, we focus on blindness. I have the honor of Dr. Mrs. Yemisi, all the way from Ikorodu General Hospital, doing justice to the conversation. I would like us to quickly attend to this first question that is coming up. Someone said that, is it wrong to get glasses without prescription? And I think that is very true. You see some people who just go down to garage, they will just ask for recommended glasses, and then the next thing they tell you that I have short sight, or I can't. Is that okay to do if you know the glasses works for you?
Okay, so since you wanted to ask a question and this person is already asking that question,
Yes.
maybe I should jump to
Okay, we could just attend to that.
that prevention part.
Oh, okay.
So I would say yes, it is wrong in the sense that, first of all, you need to have your eyes checked by an ophthalmologist.
Okay.
Have your eyes assessed by a professional. Any complaints that you have, go to the hospital. Let them look at your eyes. If you need glasses, they send you for glasses. If you need medication is prescribed to you. Now, checking your eyes routinely is part of the early detection of glaucoma. Because like I said, there is usually no complaint. It's a silent thing. So unless a person checks their eyes regularly, they will not know that they have glaucoma. Now, like you said, some people go to garage, some people go to Lagos Island, they change their glasses. I can't see every year, every 2 years. In another 5-10 years, then when the vision is very bad, they now find their way to the hospital. By the time they are examined, it is discovered that it's actually glaucoma they had all the while, and is at the end stage glaucoma. So it is better, even if it is glasses you need or you feel that you need, have your eyes checked. Be told that you need glasses. Then if you decide you don't want to do it at the hospital, you have a choice of where you want to go. But first of all, have your eyes checked by a professional.
Okay, you've heard it from Dr. Mrs. Yemisi Alabi. Always ensure that you get your eyes checked. That is actually very important. It's key. We still move ahead on the conversation. You spoke about just two of this blindness, so we can still move ahead to the third one and get a proper definition on that.
So the third one we're going to discuss is age-related macular degeneration. Now there is a part of the eye, at the back of the eye on the retina, is called the macula.
Okay.
And it's very important for central vision. So this one is age-related. That means it is commoner in older people.
Oh,
so
okay.
there are lesions on that part of the eye that affect the vision. And what does the person complain of? You know, in glaucoma we said it's the peripheral vision that goes first. The person can see straight, so they are still thinking their vision is good. Whereas in macular degeneration, is the central vision that is affected.
Okay.
So they have a feeling, they say, oh, I'm seeing a black circle in the middle of my eye. I can see peripherally, but it's as if there's something blocking my central vision. Or they are having spots in that central vision. So they will not be able to see, fine and sharp vision. They will not have it. They won't be able to read small prints. Now, the treatment for this is, we have some injections that they put in the eye, where even ophthalmologists have to refer to other ophthalmologists who specialize in that area.
Okay.
Injections in the eye and laser treatments for age-related macular degeneration.
All right. Okay. I would take in just one or two calls because I see that some of us would like to ask directly Dr. Mrs. Yemisi some few questions. You can call us on 0904-081-1061, 0904-081-1061. All questions should focus around blindness because that is the order of the day right now. That is what we focus on today. We still move ahead. We still have to talk about the treatments and the preventions proper. But we'll go on this very short breather. When we return, we continue with the conversation. The issues on IKD 106.1 FM. Don't touch the dial. We'll be right back. 6.1 FM. I believe you're enjoying every bit of the conversation. At the same time, I want to know and want to believe that you're learning as much as you can while we focus on blindness today. Having the chief consultant, ophthalmologist, and head ophthalmology department in the studio today. And 0904-081-1061 is the phone line where we will take just two calls to add to the conversation. Just two calls on 0904-081-1061. I come back to you, Doctor. Let's talk about how to prevent all of this blindness, because it has come to stay whether we like it or not. It's something we have to deal with. But then how can we prevent them?
Okay, so I'm going to leave the other causes of blindness and go on to prevention.
Okay.
So the first, I'm assuming that's what you're asking me to do.
No, we're not leaving them. We're still coming back to them.
Okay.
Or perhaps if you would prefer, we just tackle all of them first. But let's take this call quickly first. Hello. Good afternoon. What's your name and where are you calling us from?
My greetings to the doctor. Please, I got the question for her.
Okay, she can hear you clearly.
Okay, I was diagnosed of having glaucoma for about 3-4 years now.
Okay.
And I was asked to use eye drop, which I've been using for the past 3 to 4 years. Am I supposed to continue using it forever?
All right. Okay, she would. What?
That's Timolo.
All right. She will attend to your question, but I didn't get your name. Sorry.
It's for you and it's for you.
All right. Thank you very much. Your question will be attended to. Thank you. All right. I don't know if all of that is said. Okay. Maybe we could attend to that quickly.
All right. So we said at the beginning that glaucoma is irreversible.
Yes.
Glaucoma does not have a cure. It can only be treated. It can only be controlled. So you have to keep using medication.
Okay.
Forever. It depends. So if you have had surgery, I said the aim of treatments in glaucoma is to control the eye pressure. There are different modalities of controlling the eye pressure. Number 1 is eye drops. Number 2 is laser. Number 3 is surgery. So if you have been placed on eye drops to control your pressure, you have to continue using it.
Okay.
If you stop using the eye drops, the eye is going to continue deteriorating gradually. You will not notice. But when you use the eye drop, it controls the pressure and preserves your vision. It's not like malaria. When you say, I went to the hospital, I did a test, I took the medicine, malaria has gone. It does not go. It's always there. So you have to use something to keep it in check and control it. So it's not a matter of I've been using it for 5, 10, 15 years. I'm tired. I must be cured. You must be using something.
All right, you must be using something. Let's take this call, and after this, I think we'll. Hello.
Good afternoon.
Good afternoon. What's your name and where are you calling us from?
I'm calling from the Cataracts.
Your name, please. Engineer. Your question quickly.
I want to ask the doctor that if I am reading just the newspaper,
Okay.
my eye is feeling it. I don't know what I'm saying.
When you're reading just newspaper, your eyes will be paining you.
Or Bible.
Or Bible. All right. All right. Okay. Thank you very much. Your question will be attended to. Thank you very much. Okay, doctor, I think that's for you.
Yes. So there are many things that can cause that. But one of the commonest is old age.
Okay.
From the age of 35 to 40, one is unable to read small print. It's referred to as presbyopia. So once you see yourself that you have to start moving the book back to see, or you need a lot of light at night to see, that means you need to use reading glasses.
Okay.
But that does not now mean, because I said you need reading glasses, go to Garage or Lagos and tell them I need reading glasses.
Exactly.
You still need to have your eyes checked by a professional, because that is just one of the causes. It might be something else.
All right. Okay. So quickly, because of our time, let's look at the other two causes of blindness before we move straight ahead to the prevention.
Okay, so we're going to talk about diabetic retinopathy now.
Yes.
We all know diabetes has to do with the high level of sugar in the blood. So there are two major things that produce diabetic retinopathy. The length of the time the patient has had diabetes. So for example, somebody that has had diabetes for 1 year is less likely to develop diabetic retinopathy than somebody that has had it for 10 or 15 years. So the longer a patient has had it, the more likely they are to develop the retinopathy. Another thing is poor control. So even though someone has it for a long time, if it's well controlled, they are using their medication, sticking to their diet, the glucose level is normal, then they are less likely to develop retinopathy than someone whose sugar is not controlled. Today is 300, tomorrow is 100. It's going up, it's going down. Now, what does this retinopathy actually do? You know, the retina is that part of the eye, the back of the eye, that is very sensitive for vision. So when we have diabetic retinopathy, there are abnormal blood vessels that are developed at the back of the eye.
Okay.
And they are very friable, they're very weak.
Okay.
So they can burst and cause bleeding into the eye, vitreous hemorrhage. When it is advanced, it can also produce something that we call retinal detachment. So what are the things that patients complain about? They have multiple objects moving around in their eyes. All of a sudden, it's like a shower of dust. They cannot see. Sudden or severe sudden loss of vision. Sometimes when the patient has retinal detachment, they feel as if something is actually covering their eye. You know, like at night when you want to sleep and you draw the curtains to keep out the light, there's actually a feeling of a curtain is coming down and covering my eye. You know, what is the treatment for that? Diabetic retinopathy. Also, we have some injections that are used. Some can be treated by laser and some have the option of surgery. Now, one that I want to talk about, uncorrected refractive errors. This one causes more of visual impairment. You know, we spoke about different degrees of visual impairment. It causes more of visual impairment than blindness. Now, normally for us to see, if you are looking at an object, that object reflects light into your eyes.
Okay.
The light goes into the eye and is focused on the retina. That is why you can see clearly. So when we have a refractive error, the light enters the eye but is not being focused on the retina. It's focused either in front of the retina or at the back of the retina. So the image is blurred, it's not sharp, it's not clear. You know, it's like something that is out of focus. We have different types of refractive errors. Myopia, complaining I can't see something that is far. It's only when the thing is near I can see. I spoke about one just now, presbyopia, that has to do with the age, is a refractive error. Long-sightedness is also a refractive error. A lot of people are walking around with refractive errors that don't know because they haven't had their eyes tested. Do you know some people don't even know that they cannot see with one eye until they go to the hospital and you sit down and they tell you cover one eye, read the charts,
the other.
and they're like, I can't see. They don't know that they cannot see. You know, so what is it that we use to treat refractive errors? Simple glasses. Just go to the hospital, have your eyes checked by the doctor, you will be referred for glasses, the test will be done for you, and you wear your glasses. Now, another misconception that people have is that glasses corrects vision. So when you tell somebody, you need to use your glasses, like somebody said, I've been using drops now. Am I going to use it forever? The person is, I'm using glasses. Am I going to use glasses forever? Glasses does not cure the eye. You know, I said something about light, the direction of light. So when you have your glasses on, it alters the direction of that light and it focuses it on your retina. When you take it off, your eyes are still your eyes. So when you need glasses, you need to wear them indefinitely. Unless maybe when you were growing up, the refractive error was a small one, which you could have done without anyway. That's when people say, I was using glasses before and I'm not using it again and now I can see, because the error was not that
Some
much.
will say it's a miracle.
Well, it is not that much to start with. You know, so apart from glasses, we can also use contact lenses. And for some refractive errors that are very significant or high, there is the option of what we call refractive surgery, which is a mode of treatment for that as well.
All right, thank you so very much. Let's attend to this question as well. This person is asking a question that, could blindness be hereditary?
I would say yes, in the sense that some of the conditions that we have discussed now are hereditary, especially glaucoma. It tends to run in families. So if an individual has glaucoma in a family, there's a tendency for more people to have glaucoma in that family than in a family where no one has glaucoma.
Wow.
So it tends to run. So disease, I won't say blindness runs in families per se, but I would say the diseases that produce blindness tend to run in families. So if somebody in your family, you have heard, my uncle, my auntie, somebody has glaucoma, go and have your eyes checked.
All right, so let's talk about the treatment of blindness. 0904081161 is the phone line. We'll take just one more call. I see the calls coming in. I apologize. It's important we learn from that which Dr. Yemisi is saying. Let's talk about the treatment of blindness. How do we treat blindness?
I think I've addressed treatment in talking about the different causes of blindness.
Yes.
So maybe we should focus more on the prevention, because
Okay.
the treatment depends on the cause.
On the kind of cause, yes.
Treatment for cataracts is surgery, like I said, as opposed to glaucoma, which is eye drops and different types of surgery as well.
Sorry to cut you, doctor.
Yeah.
Is it to say that you cannot just have a general form of treatment for blindness, like this is how to treat blindness generally? Nothing of such.
That's what I'm saying, that it depends on what is causing it.
Okay.
So what is causing it? We treat that thing to prevent blindness. But when blindness has occurred, there is no treatment for it.
When it has occurred,
yes,
there is no treatment.
The person is blind. The next thing to do now is rehabilitation. How do we make this person productive in society? How do we make them learn to be independent, able to move around by themselves, not depend on people to do stuff? You see some people like that on the road, walking with their stick.
True, yes.
Yeah, so once blindness has occurred, there is no treatment for it like that. The thing is to focus. That's why the focus is on check your eyes regularly. The early causes, detecting early, treatments to prevent, not cure blindness.
All right, very well. Then let's talk about the prevention of blindness quickly. Thank you.
So I'll go again, talking about the one that we spoke about. See your ophthalmologist regularly. Now, who is an ophthalmologist? Somebody that went to medical school for X number of years. After graduation, you go for ophthalmology again, another X number of years. Wow. So if you have never had your eyes checked, I would suggest that you schedule an appointment and have your eyes checked before the end of the year. Now, when the person has been assessed, the doctor will now tell you, your eyes are okay, nothing to worry about. We can see you once a year, we can see you once every 2 years. But if anything is detected, then your own appointments will be more frequent so that it can be monitored. That's why we were talking about early detection. We were talking about glaucoma. Since it doesn't have symptoms, how would the person know? So you need to check your eyes regularly, especially if there is a family history of glaucoma, if there is a family history of blindness. Your eyes need to be checked regularly. So when the doctor has seen you, they can now say, okay, you are okay once a year. You are okay once in 2 years. You have glaucoma. Take your medication. This is what you'll be using. We'll see you once in 3, 4, 5 months. It depends. The second thing is that once you have a complaint, see an eye care professional. That's in their eyes. You will be surprised at the things that people put. Herbs, herbs that have been mixed that you don't know what they contain. People put those things in their eyes. So I also want to re-emphasize, don't just buy any product and put in your eyes. Don't go to anybody that is not a professional. We should develop this culture of, if I have this problem, I should go to the person who knows about it first and not last. Then another thing is to treat associated medical conditions. We said one of the things that causes blindness is diabetic retinopathy.
Yes.
So when you have conditions in your body that can affect the eye, treating those conditions and making sure that they are controlled will also help in keeping the eye seeing for as long as possible. Now, healthy lifestyle choices, all the things we know about, such as good and balanced diet, maintain a good weight, exercise regularly, at least 30 minutes a day, even if it's just brisk walking. If you are smoking, stop smoking. And we have dietary supplements. There are different ones, all these multivitamins, one a day. They have all these antioxidants that are good for the health of the eye. So all those things are necessary to prevent visual impairment and blindness, to protect the eyes. Now, another thing is protecting the eyes, another form of prevention. You protect your eyes. You get a pair of sunglasses that have ultraviolet protection. Whenever you are going out, you put them on, whether it's sunny or whether it's cloudy. Then certain occupations need to wear protective goggles when they are working.
Mm.
Welders, carpenters, people working with chemicals. You know, we have had incidents of a carpenter came in once. He was trying to hammer a nail onto something. I don't know what happened. The thing splintered, went straight into his eye.
Wow.
He lost vision in that eye, which would not have happened if he was wearing just simple, even if it's just plastic, you know, protective goggles. So we need to imbibe that culture. Another thing I want to mention is, I don't know, it might not be politically correct, but when it comes to discipline of children, I want to implore us to look for other avenues besides caning and beating, because several people will come. At the end of the day, they've lost vision in the eye. What happened? The teacher was trying to beat him while he was jumping. Of course, you never aim to cane a child in the eye, but nobody is going to be caned and stand in one place. They'll be moving around.
Exactly. Anything can happen.
Exactly. So the trauma to the eye causes bleeding to the eye and other complications that lead to blindness. So if we should look for other means of discipline for our children as opposed to corporal punishment.
I want to say thank you so very much, Dr. Mrs. Yemisi Alabi. I, for one, have learned a lot, and I will personally visit you someday soon to check my eyes too. I think it's very important. Let's attend to this last message before we sign out from today's show. Someone is saying that sometimes you just have funny feelings with your eyes, and mostly Yorubas will just say that that is, this one that came will go. We naturally just believe that the eyes is protected spiritually. It will come and it will go. Your word of advice as a professional, a medical professional, to people like this.
I'm going to say it again. Any complaint you have, it's better to err on the side of caution. You know, prevention, they say, is better than cure. Any complaint you have, just go and see the professional who is trained in that area. It's better for you to go and they'll say, there's nothing wrong, it's okay, don't worry, than for you to assume that there's nothing wrong and then years down the line, you find out that you actually had glaucoma, even though you thought, oh, it was nothing. At that point, nothing can be done about it. So even for whatever area of the body, let's develop this culture of seeing the professional trained in that area first before we do any other thing.
All right, thank you so very much, Doctor. Your parting words to everyone listening to you out there. This is the voice of Dr. Mrs. Yemisi, all the way from Ikorodu General Hospital. Your parting words to everyone out there.
Parting words. I just want to say it's been a pleasure to be here, and I want to say that you know, the Bible says Ojuni Mole Ara. I pray that Ọlọ́run ò ní gbójú lọ́wọ́, Ọlọ́run ò fẹ́ gbójú lọ́wọ́ anybody anyway. So Ọlọ́run ò ní gbójú lọ́wọ́ wa. And I pray that the Lord will help us to do and play our own part when it comes to being healthy and taking care of ourselves.
Thank you so very much. This is how much we can go today on the issues. My name still remains the same, Adebambo Opayemisi. A very big thank you. Let's do this again tomorrow. It's an honor to have the Chief Consultant, Ophthalmologist, and Head Ophthalmology Department, Ikorodu General Hospital, in the studio. Once again, I say good afternoon to you, and thank you so very much. It's a bye for now.